Hello everyone, I'm Abhishek, a specialist pharmacist in HIV and sexual health, and today I'm back with another educational video. Now, people often ask me, when should I test for HIV? The answer depends on when you were exposed and which test you use. So let me explain very simply. The simple answer is you can't test straight after exposure. The tests that we have won't pick it up yet. But that doesn't mean that you should wait and do nothing. If you think you were exposed to HIV, go to a clinic straight away. You may need PEP or post exposure prophylaxis. It's a medicine you take for 28 days. PEP can stop HIV, but only if you started within 72 hours. At the clinic, the doctor or a nurse will do a risk check. This means they'll ask you what happened, when it happened, and who it was with, so they can work out if PEP is actually needed. They'll also do a quick HIV test, some other blood tests, and start you on PEP if they think it's the right choice. Now, when should you test for HIV? Well, a lab test usually can pick it up in 2 to 4 weeks. By 6 weeks after exposure, it's very accurate. And 12 weeks after exposure, it's 100% sure. So, the best plan is test at 6 weeks after exposure and then again 12 weeks after exposure to be absolutely certain. Also, if you are often at risk, like having multiple partners, or having sex without condoms, or sharing needles, that's when it's recommended to test every 3 months. Also, talk to your clinic about PrEP, something called pre-exposure prophylaxis. It's a daily pill that protects you from getting HIV. So, who should really test for HIV? If you've had sex without a condom, or have new or many partners, if your partner has HIV but is not on medication or is missing doses, if you share needles, or if you're just unsure and want peace of mind, then I would recommend you should test. Equally, who shouldn't get tested? Well, if you've never had sex, or you're in a relationship where both partners were tested and you always use condoms correctly, or you've never been exposed to blood or needles, then your risk is extremely low. But remember, like I said, if you're ever in doubt, testing is always a safe option. So, here's your simple action plan. If you've been exposed to HIV and it's within 72 hours, go to the clinic and ask for PEP. Test at 6 weeks after exposure. Test again at 12 weeks after exposure. And if you're often at risk, test every 3 months and think about PrEP. So, when should you test for HIV? Well, not right away, but don't wait to get help. Go to the clinic, ask about PEP, and test 6 and 12 weeks after exposure. Stay informed and stay safe. And if this video helped, please hit like and subscribe so more people can learn as well. Before you go, a quick disclaimer about this video. This video is for educational purposes only. It does not replace medical advice, diagnosis, or treatment. Always speak with a qualified healthcare professional about your health. The creator, aka I, is not responsible for any action taken based on this content. That's it for today. Until next time, stay safe, folks.